Hello everyone, my name is Brianna Burke and this is my Teach 1 segment for HAP 360 on precision and preventive medicine. The purpose of this assignment is to understand the skills associated with being able to analyze patient responses. In this example, antidepressant medicine within a large group of patients. This skill helps analyze responses to antidepressant medicine through the given genetic and phenotype factors that are valuable, predicting treatment success in order to indicate if the medicine is effective as well. From the data provided in class, there is a lot of data that has been collected from the Hamilton remission genes and its non-genetic outcome. There are numerous types of data that have been collected in the datasheet, over 95 different factors, and when figuring out what information can be useful, it can be quite overwhelming with all the data present. The best way to conquer this is by copying and pasting the valuable information that we need for the project into a separate sheet in order to minimize the obsolete data that will not be used. For the Do 1 assignment, one of the tasks is to create a table showing the relationship between anxiety diagnosis and the response to Zilafrim, a drug, and report the rates of success for that drug among patients with generalized anxiety depression. As highlighted in light green, there are different types of grades that mean different things. A 1 indicates success, a 0 is failure to respond, and no entry indicates that there was not tried on the patient. Now to put the information to use, you must create a pivot table. As highlighted in blue, the diagnosis is put in column A in an Excel sheet. The antidepressant is highlighted in light green and is put into row 1 as shown in our mark table. And the medication analyzed, which is highlighted in light yellow, is where the different grades of how well the medicine goes. From there, the data is entered and we can get a rough estimate of what the pivot table might look like. However, we are only halfway done and now we need to edit and finalize the table. From there, a pop-up will happen on the left side. Under that, you need to go to the summation sign values and change your value field settings to count instead of the original sum option. Once you complete that, your table will be edited and corrected into its final form. Once the table is corrected to the count and everything looks alright, we can move on and analyze the table. In order to analyze the possibility of success, we must take the people that had success, which in cell C5 in this case, and divide it by the people who attempted the drug found in cell D5. So, 117 divided by 366 is 0.319, which is our possibility of success. Sometimes not every medication always has the data that can be used. If you run into a problem that the medicine was not tried on the patient and the cell of C5 is blank, then we do not know what their reaction would have been. Therefore, the probability of success cannot be calculated because of the lack of information. Now that you know how to create and analyze a pivot table, if you follow the examples shown, the ability to take on various situations that rely on preventative medicine should be easy. Just follow the example shown to also calculate the diagnosis versus the success of medication analysis for the pivot tables and the probability of success. Hope this provides help. Thank you for your time.